Today, the Belize City Council donated testing booths for medical facilities across the old capital. By the end of the day today, 3 facilities, including the Karl Heusner Memorial Hospital, had the air-conditioned 50 by 48 wooden structure installed on their respective compounds. It will now be used to test suspect COVID-19 patients. The first stop was at the K.H.M.H, where just outside the accident and emergency wing, a designated area had been identified.
I was able to make contact with some donors because we felt that as a city we needed to contribute to help the whole effort in this COVID pandemic. We actually lost one of our workers there, and we felt compelled that we had to help in this area, especially in the testing area, because we believe that maybe if things were much better then, what happened would probably never occurred. So we, instead of just moping about, we said we wanted to ensure that we provide testing booths, and so we are giving 2 of these testing booths to K.H.M.H and 1 to Cleopatra White and 1 to Matron Roberts as well.
The monetary value of the booths is $2,000 each, but is priceless when it comes to the level of safety that it provides for frontline workers while carrying out an essential service. Unit Manager of Accident and Emergency, Casilda Bowman, is also the manager of the Isolation Critical Care Unit of the K.H.M.H. Nurse Bowman explains the importance of this donation for her staff.
What we're trying to do is from the point of entry to identify persons who we consider as a suspected case, and that we examine them and do the testing out here, so it decreases the exposure to the rest of the staff. All right, so our first point of testing is here. We have a nurse that is identified to do a triage of all the patients who come into the emergency department. They then determine if the patient has symptoms of COVID, and they identify them. They would place them here. A physician then is identified and also will come and do the procedure of testing the patient for COVID.
The booth provides a shield for the medical officer who swabs the patient. That sample is then carefully managed and taken to the central lab at the adjacent compound for testing. Now, if the person is critical, the patient will be placed inside 4 isolated rooms within the accident and emergency wing until his or her results are returned. If positive, that patient will then be transferred to the designated Isolation Critical Care Unit for COVID-19.
We would be focusing on COVID that comes along with an emergency issue that we need to be dealt with. If they suspected COVID but stable, then we have Cleopatra White, the testing center. But if they have a medical condition that requires E&E management, then we will deal with it.
Every patient that comes in, it doesn't matter the mode of transportation, they are assessed and checked for any symptoms of COVID. It doesn't matter how you come in, we have to test you first. We have to check you first, all right? Meaning we do it through a triage system where we ask you several questions that meets the case definition, all right? And based on that, then the nurse decides, okay, this patient can come up. This is one step in trying to reduce the amount of patients who go in there and expose the staff. But we also have our nurses being prepared that assume that everybody is a suspected case until we know that they're not. All right, so they have to prepare their protective gears. Everybody wears a mask that is dealing with a patient. A patient comes in from here, from this area, with a mask. So you know that decreases the transmission.
The Cleopatra White Polyclinic on Princess Margaret Drive has been designated by the Central Health Region as testing area for persons with respiratory complications, one of the symptoms of COVID-19. Regional Manager Melinda Guerra says that the donation is timely.
This is going to assist our medical officers and nurses, in being able to do more swabs, nasal swabs for suspected cases of COVID-19, so it comes in very handy. Since the entire COVID-19 response started in January, we have been at the forefront of ensuring that we carry out all the necessary investigation, the screenings. We move on to another step, in the prevention and control, where we carried out investigation of contact tracing and mapping exercises. And now at this facility, anytime we have any swabs to be done, then we would refer our patients to this clinic, Cleopatra White Polyclinic, where the doctors will do the swabbing. The nurses do the screening, and the doctors, do the swabbing.
Duane, Moody for News 5.